Hello, I'm Nancy Andrews. I'm a dental hygienist and I'm a professor at West Coast University. I'm course director for general pathology, oral pathology, and infection control. This educational segment is brought to you by Kerr Total Care. Welcome to a quick review of the fundamentals of infection control and how we apply those in a clinical practice. So today we're going to go over how diseases are transmitted, the basic fundamentals of disease transmission, and then we're going to apply those ideas to clinical activities and products that you use to make sure that you're safe in your dental practice. There's some basic concepts of infection control, and whether we think about it or not, we apply these all day long, every day, in a variety of ways. One of the fundamentals is just simply understanding how diseases are transmitted. Another one is isolate and separate. You know this. You do this all day long. Your mother probably taught you about this. If somebody's sick, you stay away from them. But it's applied to other things, how you place things in the operatory, how you place people in the clinic, how you move, what you touch, what you don't touch. You're isolating, you're separating. And maybe you're just putting a barrier, a plastic barrier between you and a surface or an item. That's the same principle. You're just applying it in that way. Another principle is clean before you disinfect. It's really important to do that. And we do it with our hands. We clean them. We kill germs with chemicals. Sometimes we do those steps together, sometimes we separate them. When you're cleaning a surface, you can't apply a disinfectant on a surface without pre-cleaning that surface. So whether we know it or not, we're applying the concept of cleaning before we disinfect. And it has the same application to instruments. If you're cleaning your instruments prior to sterilization, you're applying that theory, because you know that if you put dirty instruments in a sterilizer, the sterilizer can't be depended on to actually sterilize those instruments. It's only made to work on pre-cleaned instruments. So those are some basic concepts. Let's just go over how diseases are transmitted first. I think the easiest way to remind ourselves of how diseases are transmitted is to visualize a chain in a circle. We call it the chain of infection. And every link in the chain must be in place in order for a pathogen to travel from one person to another. And the chain is in a circle because the disease can come back around. So at the top of the chain, the top link is pathogens. You have to have germs. They can be a virus or a bacteria or a parasite. You have to have pathogens. You have to have enough of them, and they have to be virulent enough, alive enough to actually make you sick. Then you have to have transmission from one person to another. In order to transmit that disease from one person to another, you have to actually contact the source. So if it's a skin disease, it may just be touching the skin. If it's a blood-borne disease, you have to get the germ all the way from their blood into your blood. There's a transmission process that has to take place there. So there's being exposed to the source of the infection, wherever it is in the person. Then there's transmission of that pathogen from that person to you, or from one person to another person. And in the clinic, that's really important because you may be the vehicle that transmits disease from one patient to another if you don't do your infection control procedures right. So if it's a skin disease, maybe the person sheds that pathogen on a surface and the next person picks it up if you don't perform infection control correctly. If it's a blood-borne disease and they bleed while a procedure is being done and that's not cleaned up effectively, that can be transmitted if another person contacts that with open skin. So you understand how that takes place. Then if a disease is transmitted into your body somehow, you have to be susceptible. And if you're immune, then that's enough to break the link. All day long, every day, we don't break just one of those links. We break them all. We have a margin of safety that makes us very safe at work. We recognize that people have pathogens. We know that. We isolate, we separate, we take safe precautions. We have safety devices that we use. We try not to poke ourselves or poke anybody else. If we make a mess, we clean it up. And we take care of germs after that by sterilizing and disinfecting. We use barriers and we wear personal protective equipment. And maybe one of the most important things we do is hand hygiene. The Centers for Disease Control has identified hand hygiene as the most important thing we can do, right or wrong, for infection control, because essentially everything we do with our hands. Now, an important thing to remember about the chain of infection is that the chain has to do with the transmission of body fluids from one person to another. That's important because body fluids, whether they're wet or they're dry, and maybe dry for many days, can transmit diseases. So let's get started with hand hygiene. Remember, it's one of the most important things we can do. So let's talk about our options, how you can do hand hygiene well, and what some of the common mistakes are. So applying the idea of cleaning before you disinfect, you would wash your hands if there's something physical on your hands to remove. When we get there in the morning, first thing, we're told by the Centers for Disease Control in the United States that we should be washing for a minute, maybe even 2 minutes, to do a long wash and remove all the organisms, skin cells, all the things from home, and leave them there and not bring them into the clinic. And at the end of the day, we're told we should do the same thing. That's important to do. But throughout the day, it's unreasonable to wash your hands that many times during the day for that long. So thinking about what you do every day between patients, try to remember how long you actually wash your hands. Because if you think about it, the soap that you use has to have time to lather, to lift. There's surfactants in the soaps. Those are degreasers. And while they're cleaning, while they're lifting proteins and debris from your skin, they're also depleting your skin of oils. So we're always kind of balancing that, trying to do it safely, preserving our skin, because we're trying to remember that intact skin is your most important personal barrier so that you don't get disease by contact. So you want intact skin, but you want clean, intact skin. Okay, let's wash our hands. First thing to do is roll up your sleeves so you have access to your wrists and your hands. You apply the soap, enough of it to really do a good job. This is nice because it's a foaming soap and it spreads over your hands really easily even without applying water. So it's already lathering. The important thing to remember is to lather long enough. Most people don't wash their hands long enough to really honestly clean their hands. So between patients and throughout the day for your repeated washes, you want to lather your hands for about 20 seconds. You want to get your fingernails, under your fingernails. That's an area that's obviously harder to clean and gets more contaminated. So pay attention to it. Cuticles, between your fingers, the backs of your hands, and parts of your wrists. And then you want to rinse completely so you don't leave soap on your hands. This is a common problem when people wash their hands repeatedly and they're in a hurry. They won't rinse carefully enough and the soap causes dermatitis. And then we want to use a clean, dry towel and dry your hands completely because leaving water on your hands can cause chapping. It's important to use products that have emollients in them that help nurture your skin. Some of the harsher soaps can deplete your skin of oils, and over time that can cause cracks that make it difficult for you to do your job, because your skin is a portal of entry for pathogens and allergens and toxins. The other option you have besides a plain, gentle soap is an antimicrobial soap. And sometimes people use only antimicrobial soaps with a chemical formulation that kills germs all day long, and sometimes they'll alternate them throughout the day. Another protocol that the CDC recommends is alternating between hand washing and applying alcohol sanitizers. They're for completely different reasons, but it's very useful in a clinical setting. Your hands need to be washed, or you need to apply an alcohol sanitizer before you glove and after you take your gloves off. And that's a rule that a lot of people forget, but it's very, very important. The other thing that people forget about is that they wear their jewelry and they try to wash around it. They have long fingernails, they have fingernail extensions, they wear fingernail polish, and all those things can be a problem for two reasons. Number one, they harbor organisms and make it difficult to clean your hands. And number two, they may damage gloves. So for those two reasons, really jewelry is not recommended, and neither are long or embellished fingernails. Personal protective equipment. You're wearing your gown, it's probably on. You've probably got your eyewear loops, and you're going to put a mask on, and you're going to have gloves, and maybe a hair cover, maybe a face shield. Let's talk about the order that you put them on and where hand hygiene comes in there. So you've got your gown, you've got your eyewear. The next thing is covering the rest of your face. So you can put your mask on. There's an outside and an inside to a mask. The outside is usually the colored part if you have any color in your mask. Otherwise, it's the more textured part of the material. The smoother part goes near your face. Ear loops, they come in all kinds of varieties. The most important thing is that you pick a mask that actually will protect you at the level that you need for the procedure you're doing. And there's a variety. You want to use low, moderate, or high barrier masks depending on what you're doing. The other thing about it is whether they fit your face. And this is kind of a nice design because it has metal across the top, metal across the bottom. You can pinch it and it doesn't gap. So you've got your face covered. You may also, depending on what you're doing, want to put a face shield on. So you put your loops down, and you could use this kind of a face shield that covers it up. Now you're pretty well covered, and you don't have to touch that again. So now's the time where you roll up your sleeve, you perform hand hygiene, and then, last of all, down the sleeves and put on your gloves. And when you put them on, you want them to cover up your cuffs. And that should do it. For eye protection, you have other options. You can use your own glasses, and you can use either disposable or reusable glasses on top of those. The most important thing is that you get side protection. That's really important, and that's one of the things that people kind of forget. To clean and disinfect your operatory between patients, you want to wear the right personal protective equipment. So heavy gloves are recommended if you're going to be touching chemicals. And face protection is essential so that you don't get splashed in the face. So you have some options. You can have a shield, and that protects your face, or you could wear eyewear and a face mask. Either one. For cleaning up the operatory between patients, let's talk about surface disinfection. And remember that pathogens on surfaces can transmit disease, sometimes up to a week. Dried blood on a surface, we know, can transmit hepatitis B after it's been there for a whole week. So every time you do it, it's important. Every day it's important. So we have options. We can clean a surface with a surface disinfectant spray by spraying it on and wiping it off. And that's the cleaning step that many people forget. The next step is spraying it on and leaving it. And that's the disinfecting step. Even if you don't see anything on the surface, remember that you're aiming at organisms and you can't see them. So you always want to do 2 steps. You clean and then you disinfect. And then you leave it on the surface for the time that it's supposed to work. And it's different for different products. This one happens to be 1 minute, and that's really convenient. But if you're using a product that says 5-minute TB kill, 10-minute TB kill, the second part of that procedure, the disinfection, has to go on for that amount of time, and the surface has to remain wet. Many people have gone to pre-saturated wipes. There are a lot of good reasons for this. It's faster and it's easier, and you seem to need less fluid to do the same amount of job. So the kind of wipe that you use is important. Does it hold a lot of fluid in it? Does it rip apart? Does it do what you want it to do? So with a wipe, you just simply wipe it once, and that's the cleaning step. And you throw that one away. Get another wipe. Wipe it again. And leave the surface wet for however long that chemical requires. Today, many people are trying to reduce the amount of chemicals in their environment, and one approach is to use plastic barriers on surfaces to decrease the use for surface disinfectants between patients. And that's a viable option. If you have a drawer, say, that didn't have a barrier on it, you would still wipe it between patients all around the drawer, not just the handle, but every place that you might have touched. Throw that one away, get another wipe, and apply the disinfectant and keep it wet for as long as that product needs to stay wet. That's an option. The other option is to apply a barrier, a plastic barrier, over maybe the most used drawers, the highest touch areas, or any kind of shape that's complex and difficult to clean. Those are the best things to cover up with a barrier. So between patients, if the barrier really did cover the whole handle that you're touching, all you have to do is carefully remove it and put another one on between patients. Everybody always asks, do I need to clean and disinfect after I take the barrier off? And the answer is, if the barrier was compromised, absolutely. The other answer is, did you put the item in their mouth? Because if you're using a digital sensor, that's a different standard. Digital sensors are kind of an exception to all of our infection control rules. The rules are, in dentistry, if you put something into somebody's mouth, it should either be used once and thrown away, or cleaned and sterilized and made safe for another use. But digital sensors won't stand up to either of those. You're not going to throw them away, and they can't be sterilized, at least with today's technology. So your options are to put a barrier over these, use them, and when you're finished, you take the barrier off, but then you apply an intermediate level surface disinfectant according to the directions, so that you do 2 steps. You clean it, and then you disinfect it, and you let it stay for the stated time, and you put another clean barrier on for the next patient. And I mention this because this is an area where if people don't really understand what's at stake, they might take shortcuts. They might not use a barrier, they might not clean between changing the barriers between patients, and there's risk there, so people need to understand that protocol. Intermediate level surface disinfectants or even low level surface disinfectants are made for cleaning and disinfecting hard, non-porous surfaces, which means they're not ideal for upholstery. Most chair manufacturers are going to recommend that you cover the upholstery with barriers for use with every patient. You just simply change it between patients. It's very easy. And at the end of the day, and intermittently, you apply surface disinfectants or even more gentle soaps on the upholstery of the chair. That'll preserve the material, and it's enough. And patients see the barriers, and it looks clean to them. This air water syringe can be used to talk about a couple different important topics. One thing is using a barrier on a complex surface, and a lot of people like to do that and change the disposable tip and that all at once. Then they come back with a surface disinfectant and clean it and disinfect it between patients. The question is, how much do you have to clean and disinfect if there was a barrier on there? Once you remove the barrier and the disposable air water syringe tip, then a lot of people wonder if they should use a surface disinfectant. And the answer is yes. Right where the opening was, where there was contamination, it's best to surface disinfect that one area. But you don't need to carefully go over all of the details of this piece of equipment with your surface disinfectant if you've used a barrier and the barrier is intact. So it really does save money if you use the barriers. Air water syringe tips can become contaminated when you use them on a patient. They're difficult to clean inside because the lumen is so small. So the truth is, people don't do it. Disposable air water syringe tips save a lot of cross-contamination, and most of us in infection control recommend these. So between patients, all you have to do is just take them off and throw them away. I highly recommend that. Most people use light handle cover barriers. It's the most common barrier used. It's something we always touch when we're working, so if you don't have it on, you know that's contaminated. All around it. See how you grab that and move it? The whole thing gets contaminated. So if you're using a barrier that only covers this part, you need to remember to clean it all. When we seat our patient and place the bib on them, for many, many years, we've used the old-fashioned bib clips, but we probably know that they become contaminated and they can transmit pathogens. There are better options today. There are autoclavable ones that can just be used and put in the autoclave, and it's a great choice. There are paper ones, and there are bibs that actually stick to the patient's chest. They're all different kinds of options, but please pay attention to little things that stay around that don't get cleaned between patient visits. Instrument sterilization is our highest level of asepsis in dentistry. We actually sterilize everything. Nothing else comes close. Everything else is an estimate and gets things pretty disinfected, but never to the level of our instrument sterilization. And not only do we achieve that, we test that and can validate that. So the stakes are high, the processes are exact, and it all starts at the chair. So if you want to streamline the process, a great way of doing it is to basically use an enzymatic foam that sprays on your instrument and starts the cleaning process right there while you're tearing down the unit. So you just spray everything, let it sit, and it's like a holding solution, and it takes the place of a soak, and the enzyme starts breaking down proteinaceous materials. So these instruments can stay for 5, 10, 15 minutes, 30 minutes, however long it takes you to get to them in your busy day. Now, Now we're ready to transport the instrument safely to sterilization. So you close your cassette and carry the whole tray safely into sterilization. In sterilization, you're just going to rinse these. Now you see why you've got your heavy gloves on and your face protection, because it splashes and people can poke themselves on sharp instruments during this process. Your chances are minimized by using cassettes and by not scrubbing your instruments, and then the foam spray as a first step really reduces the amount of scrubbing that anybody has to do. The next step, once it's rinsed, is to put the instruments in the ultrasonic. You also can put them in a washer disinfector. Either way, the next step is mechanical cleaning. And after that, you rinse it again if it's been in an ultrasonic, and then open it, and then inspect your instruments, and only then, if you need to scrub them or further clean them manually, that's when you do that. After your instruments are pre-cleaned and they're on the dirty side of the sterilization room, you want to pouch them or wrap them in wrap. So they're ready to go. They need to be dried and wrapped, and then they go into the sterilizer. If you have individual instruments or you're using pouches and you're not using cassettes, make sure that the pouches are new each time, never reused, and that they're folded so that the seal actually does prevent air from getting into the package, and that way it can remain sterile until it's used. Okay, we're ready to sterilize our instruments. And sterilize them. But the key here is to put dry instruments in and hope that you get dry instruments out. If too much water goes into the cycle or you shorten the drying cycle, you're going to get wet instruments when they come out. And the paper on the wrapping will wick and it won't protect those instruments. So whatever you do, don't shorten the drying cycle. Make sure that the sterilizer is working correctly and that you're monitoring it with biological monitoring, as well as using pouches that have indicators on them that show when the instruments have been sterilized. One more thing, it's really important to write down the date that you sterilize the instruments, the cycle, and which sterilizer if you have more than one. That way, if you come up with a failed biological monitoring, you know for sure which instruments were involved in that. Remember that your sterilization area is for sterilization. It seems to be one of the places that we meet. We talk in there, we eat our lunch in there, we put on our makeup in there, we do all kinds of things in there, and cross-contamination is a big problem. So keep a dirty side where the instruments are dirty. Respect that. Have a clean side where only clean instruments can be, and please take other activities outside of this area or clean up and disinfect before and after anything else is done. In order for all your infection control efforts to be successful and to save time and make your life much easier, the operatory needs to be uncluttered. Everything that can go off of the counter should go off. It should go in drawers or in another room. Then when you clean and disinfect, it's going to work. This educational segment is brought to you by Kerr Total Care.